What's up, you guys? This is your boy Miguel giving you your daily dose of radiation. In today's video, we'll be covering how do X-ray techs keep the patient safe during an exam. So depending on which type of exam and there's like several of course you want to keep every single patient as safe as possible, but depending on like if it's a trauma, if it's someone young, if it's a baby, like there's level of safeties that you'll go through depending on the circumstances and also the tech and also where you're working at. And I mean, keeping it just like plain honest, the older the tech is, most of the time, it's gonna sound mean, but they quit caring. The older you've been, like certain techs, other ones are like, oh, but certain techs, like the older techs who've been in the game, like they like care just a little bit less, and most of the time, and not even they fault, because it's the doctors. Like sometimes, especially us, like brand new, like you'll try to do everything, and then slowly over time, you're like, well, even if they're pregnant, which most of the time, that's like the biggest scare. Oh, they're pregnant. They shouldn't get the extra. The doctor's like, do it anyway. I need it. And like, shoot him anyway. And then over hearing that over and over and over, you're just like, well, even if I tell him, he's still gonna want it, unless the patient. I'm like, we'll still tell the patient about the danger, but I'm like, the doctor's still gonna make us do it. So like, but anyways, or if they're in a trauma, because the danger of the patient's condition, especially if they're like super bad, like you have to kind of outweigh some of the safety precautions for outweigh the bad for the good type deal. So that will occur. Even if they're pregnant, the best like we can do is like probably throw a shield over the mom's chest, try to limit technique, try to limit exposures, try to get on the first shot, because like ain't nothing make you feel more burst than shooting a pregnant person and then you clip it or you mess up and you gotta shoot again and again. You feel bad. I ain't even gonna lie to you, you feel bad because radiation. But I mean, from what we learned, it's usually in the what's called the early stages, the ingestation period or whatever, pregnancy. That's like when the baby's like tiny, where pumping radiation that could have like mutation or whatever of that. Like that's like the biggest concern when it comes to that. So, and then I mean, certain people who are within childbearing age, especially like let's say they're getting L-spine or they're getting hips, most places the protocol is like they'll need a preg test to make sure they're not pregnant before we shoot them. And usually, depending on where you work, it can range from like 13 all the way to like 40-ish is kind of where you see it at, like the range. That's another safety precaution we'll take. Or we'll make them sign like a little consent form saying, oh, I'm not pregnant, or I'm pregnant but I'm allowing said tech to do this, and I'm taking like just to cover your butt type deal. We will have that. I mean, we have like the basic, the lead brand, the gonadal shield. The gonadal shield's more like for the babies, but we'll do X-rays on. Which, I mean, the longer you work in this field, you'll slowly see that most even you feel bad, especially at the beginning, because like the doctors will order stuff. They ordered a lot of exams on like people because they, I guess, justify it outweighs them being pregnant. Most of the time, that's kind of the big thing. If they're pregnant, does this outweigh? But like, I remember as a student, it took me a few times. I would always go and ask, and the doctor would be like, "Oh, just do it anyway. It's fine. Like, I know they're pregnant." happened so many times, and I've asked one of the techs who's been there longer. They're like, most of the time, the doctor don't care that they're pregnant. If this is supposedly outweighing, they're gonna make you shoot it. So I've just been kind of like, I was like, okay, I guess I'll just tell the patient what's going on, because the doctor will still want it, because supposedly it outweighs whatever. I guess in their eyes, if the mom dies, then the baby dies. So that's kind of where the priority is. Keep mama safe so the baby can be safe. So that will happen. And then I guess like when you have a baby, like a young baby, I guess like between the age of 0 all the way to like 3 or 4, sometimes like you'll have like the parents hold it. So like if there's a mom and a dad, try to get dad to hold it and then have mom step out because she's pregnant. Sometimes you can't tell patients are pregnant. So unless it's just mom, that's kind of... And then sometimes it's a 2-man team. You'll need both to do it. So that's the most amount of protection we'll do. And then over the years, there's been studies that sometimes lead shield isn't exactly the most safest. Sometimes it's better to go raw dog and not have a shield. But like the studies say, a new study has come out about that for the patient, not for us. Of course, for us, like if you're gonna be doing like a trauma hip, holding the board mid radiation, yeah, let up. Keep yourself safe, because especially if you have plans of making this your long-time career. How I see it is like each dose is like, it is very tiny, but if you think about it like in the long scheme of like if you're gonna do this for the rest of your life, it's like a tiny little hair. Like imagine you just pluck out a little hair every time you take a dose. That's how I see it. So try to reduce it. Try to have other people, nurses, doctors, whoever, hold it, keep them safe. So yeah, it's been your boy Miguel. See you on the next one.